So, for the first question, what do you do if a patient seems overwhelmed or not interested? So, first is that I try to slow down and, of course, assess what's stressing them. And what I do is that I prioritize only the most valuable information. So sometimes I pause teaching and focus on the emotional support first. So and after which I continue when they're more receptive, or when they try to answer the questions willingly. So for the second question, what are the main duties in patient teaching? When we say patient teaching, it's explaining to them their condition, of course, the medications involved, the procedures, the medical procedures, the lifestyle changes as well, and also the warning signs that they need to know, because I believe that this ensures the patient and their family to fully understand and how to manage uh, or continue the care when they're at home. So, for the third question, how to explain difficult medical information simply. So, what I try is that I avoid, of course, medical jargons. I use simple words and analogies. Sometimes I do visual tools, and also relate the information based on their daily lives. And for the fourth question, for me, what are the best teaching methods? So definitely, I believe one-on-one teaching is the best. Also, demonstrations, written materials as well. And what I try to do is that I try to let the patient reenact what I taught them on, like for example, when they're taking medications, or like uh, very important information that I need to tell them. I want them to reciprocate the words that I've been telling them, or the specific instructions that I tell them during the medical or the health teachings, so that I can fully judge if they understood the information that they need to know. So, the fifth question is, how do you motivate patients to participate in their care? So, in patient care, there's always going to be a goal. So I always involve them in a goal setting. So I would first explain the benefits of. First is, one of the goals is that they should be able to take care of themselves. So I would also encourage small achievable steps, so that they can slowly build confidence, and then let them realize that uh, they are capable of taking care of themselves. For the sixth question is, what are the common problems in patient education? So, the common problems in patient education is that, for sure, there are also some language barriers. Um, Cultural beliefs can be an example, because of how people have different beliefs. So I tend to have difficulty in um, telling information, or giving patient teaching, especially when people have their own cultural beliefs. So also, patients tend to become anxious, so they become denial in some cases in their condition. So it's not a instant process. So I try to slowly ensure the patient, or build rapport to the patient. So, what are the steps to check, or how do you check the understanding of the patient? So, first is that, again, the teach back method is very effective. Is in wherein I try to ask them what they've learned from me, and then they teach me, or teach back the things that I've been teaching them for their health maintenance. Also, For the eighth question is, what are the examples where education improved outcomes? So, for example, I have a patient who's diabetic, and then one of the treatments for diabetes is insulin. So, insulin administration and diet management, for example, are very effective methods in treating hyperglycemia, and of course, reduce. It can help reduce hospital readmission. So, those are the benefits of patient education, especially when are they are already independent of your care. For the ninth question, was the most important skills for nurse educators? So, of course, you need to have good communication. You also need to have or to establish good rapport to your patients. So that's going to be a step wherein it's going to have different um, difficulties depending on the patient. Also, you need to be empathic to your patient. You need to put yourselves in their shoes and make them, or how can I say this? So, you need to be at least sensitive to your patients and knowing their full condition so that you can communicate with them. Also, critical thinking is a very important aspect in for nurse educators, because again, health is dynamic, so it changes from time to time. It's never static, and knowing a backup plan for your patient is an important skill, and that requires critical thinking. And for the last question, what are your advice, or what is my advice for nursing students? So, start with the basics, especially in communicating with your patients. So, communication is a very vital skill for nurses, because you are not a robot, you're a human being, and nurses should be really good with communicating with their patients, because they're the ones who's taking care of patients from time to time. And that's all.